Hi, thank you very much for coming to my website or my YouTube channel. I've had a few people lately ask me how come I can't give you a plain yes or no answer, or how come I just can't make it really simple, or let's just do a phone call where I'm afraid that you'll listen to what I say, which may be wrong. I don't make any of this stuff up. I'm only helping you look at the law and decide, and the options to decide what's the best for you. I can't tell you what's the best for you because I'm not sitting in your shoes, nor do I know your finances or how you want to spend money or what you want to do for preventative care. So I'm going to go through in this video and just go over a few of the questions I've been asked lately and explain them so you don't have to read it. I'll explain it to you in plain English, but it's not what I say. It's what the law says. Like there was a David Gray commercial who said, it's not what the insurance companies say, it's what the law says. Well, I'm going to tell you where the law is, and I'm going to tell you where the insurance company things are. But it's not what I say. It's what is in print from the law or from the insurance companies. And I don't trust anything Covered California says. And for all I know, everything's going to be gone in a week or two when the Supreme Court hears the case, Texas versus USA, which is now California versus Texas. It's going to be heard November 10th. That's really close. Today's November 7th. So we'll be watching that. And all of the pages I'm going to go through will be in the links at the bottom of the YouTube video, so you can go to any of those pages directly. So to start off, the President of the United States says it's very complicated, and he's the one making a lot of the law, along with the Supreme Court. And the federal government said they weren't going to defend the Supreme Court action. President Obama made a lot of promises which didn't come through. I'm not going to go into politics. I'm just going to tell you, what the deal is so that you can make your best informed decision. So the president talks here for a minute saying insurance was very complicated. Well, he could have saved a lot of time and effort if he would have just asked me. I would have told him. And then before I started this video, I pulled up the pages I was going to need to answer the questions. And so they might not necessarily be in the best order, but, it's the best I could do. I'm an insurance agent, not a documentary maker. So our next one is that I'm not allowed to give you tax advice. And be really careful and don't take any tax advice from Covered California. Here's the Polk case where Covered California told someone that their Social Security income didn't count. And so the guy had to pay back like $12,000 on his taxes. And they took it to the administrative law judge, and the law judge agreed that Covered California made a mistake. And the law judge was upset that he couldn't order Covered California to pay the taxes for the guy because the guy would have done something else other than buy the Covered California plan with subsidies. So I recently had someone say, just give me a quote. Well, I can give you a quote. And the quote engine is all over my website right here, Instant Health Quotes and Enroll. But someone's got to explain to you that if you don't qualify for subsidies, you won't get them. Just because Covered California gives it to you, they're not the tax guy at the end of the year, which I'll get into it later. And if I forget, remind me or ask me. But you'll want to look at Form 8962. I didn't already pull that up. And at the end of the year, you file your taxes. And if you paid too much subsidy, you'll get money back. And if you didn't pay enough, or you didn't qualify, you got to give it all back. Or if you're a single and you make more than $75,000, you got to give it all back. So that's why you're mandated to report any changes within 30 days. And I had a past client that wound up on Medi-Cal, and it sounds like, I got it secondhand from their employer, but it sounds like the Medi-Cal was looking to file criminal charges against them because they didn't report that the wife got a job within 10 days. So this is serious stuff. The next thing here is that I'm not allowed to practice law. I'll show you where the law is, but you're the one that's got to interpret it. So up here, you know, because of Covered California making a mistake on the Polk case, they came out and told all agents, do not under any circumstance give tax advice or answer tax filing questions. So I'll show you all the brochures. Here's publication 974. It's like, I don't know, 75 pages. So just because I have it on my website doesn't mean that I read it or that I understand it. It's here. It's for you to look up, and I'll help you with it. But I'm not an attorney and I'm not a tax man. And this happened overnight. Covered California made us all tax advisors. So, and they suggest that if you need tax help to go to volunteers. Now, personally, I think that's worthless, but that's what they said. Okay, so here's one of the questions right now that prompted this. They're tired of going back and forth to figure out the websites. Are you financially better to go to Anthem Blue Cross PPO compared to what she currently has, which is Sutter Gold? If it requires a phone call, that's fine. Well, if I send you an email, and we'll get to this, but Blue Cross doesn't even have a PPO, then I don't think a phone call is going to straighten it out. I want to show you the exact brochure so that you can see it and have something. If you have to take the insurance company to court, you have something in writing. I don't want to be involved in any court cases. Another thing, going back to the Polk case, Covered California didn't have to pay the guy the $12,000 that he had to come up with in taxes. The problem for me is Covered California mandates that I have a malpractice policy. So if I give you the wrong advice, I got to pay for it. Whereas Covered California, I guess, is a public entity and you can't sue them. That's a whole legal question. Google it. So getting into the question of like, what's a PPO versus an EPO? And so I had a page here that explains the Blue Cross EPO, because this year Blue Cross only does exclusive provider organizations and health maintenance organizations. They don't do any PPOs. So exclusive provider basically gives you more doctors than an HMO, but you can't go out of the network unless it's emergency or urgent care. And if you want to know what those mean, you know, go to this page, click on those links, and you'll get a definition. And all the definitions, I'm not going to give you one. You got to get it from the official evidence of coverage or from the law or from a brochure. But, you know, on this well, first of all, if I didn't look it up, I would have, you know, gone down the rabbit hole with the lady that asked me that question, because she's saying she wants a PPO, but Blue Cross doesn't even offer a PPO. It's EPO. And Blue Shield does offer a PPO, but it's the exclusive network PPO, which is not the same thing. So you might ask me a question that's basic and simple, but I got to look up and give you the right answer. If you want a wrong answer, call Covered California or maybe 90% of the agents out there. But if you want a correct answer that you can take to the bank or to the court, you come here because I'll show you exactly where it is. So getting back here on the question of PPO, well, it's not PPO. So I show you the exact summary of benefits from Blue Shield because they're the only one that offers a PPO, and it's not a PPO in the traditional sense of the word. It's their exclusive PPO. Now, you would think exclusive means it's great and wonderful. No, it means it's got fewer doctors. So you're going to have to go to their provider finder and see exactly what it is. So while PPO has a big advantage of letting you go outside the network, you got to see what that means. Okay, because if you go outside the network, your deductible for a silver plan isn't $4,000, it's $6,500. And if you're out of pocket maximum, so a lot of times I'll tell people, take a bronze plan, your out of pocket maximum is $7,000 or $8,000. And if you have $1 million claim, you don't pay 20% of $1 million, you pay a maximum of $8,200. However, if you go out of network, you can pay a maximum of $20,000. Now, if you really want a doctor that's out of network, that's fine. And a PPO and even the exclusive PPO will allow you to do that, but it's going to cost you more. So I think that answers everything on this page. If you want quotes, this link is all over the place, and you can come in and get quotes. One of the people that prompted this video has Sutter Health currently. So the quote engine will show that, but Sutter isn't participating in Covered California with subsidies. So you have to do 2 quotes, one with subsidies, one without. And then all the brochure for the exact information is in their brochure, but I should pull up the metal levels. So I've been building my website since 1999, and I've built it by when people ask me questions. So I love it if you ask me a question, you can put it right on the website. You don't have to put in your name, and then I can answer it. And that's how I have such an extensive website, because I've been answering questions and working on it since 1999. So anyways, on metal levels, because one of the people that prompted this video says they want the same coverage as they had before. Well, that's one of the, I think, positive things that Obamacare did, was they made them have standard names for the amount of coverage you have. They just didn't make them have standard names for the networks. So if you have a bronze plan, that's the lowest in price. You $65 for the first 3 visits. After that, it goes into your $6,300 deductible. You have a silver plan, it's $40 for a visit, $4,000 deductible, $8,200 out-of-pocket maximum. The enhanced silver is if you're on subsidies and your income's low enough, you can get a better thing, and it's still silver. And even that, the rates change because of a court case. So everything I'm telling you now, there's some people that think on the 10th, it's going to be turned upside down. Now, from what I've seen before, I would still say that we're probably good for 2021, and then things will change. But, I don't have a crystal ball. We'll see. So if you have platinum, it's a $15 copay. But if you have an enhanced silver, that's better than platinum. And, that's only a $5 copay. So if you have any questions on this, if you go to the page in question, ask it there, and then I'm more than happy to answer it. So this is a page that we already went through. Yeah, went through that. I just rebooted my computer, and so things were slow. That's why I got extra pages here. Yeah, extra page. Extra page. Okay, so here I had someone ask me about MAGI Income. So anyways, I've got Q&A all about MAGI Income, with different things. But basically, MAGI Income is not what you did last year. It's what you're going to do the rest of the year or next year. Same thing. So I've explained MAGI Income, and I even put in a graphic showing it's your adjusted gross income, which add back in Social Security, and then the other things. I haven't had it come up yet in, 6 years of ObamaCare. But Social Security, you take the total, and then that gets in here. And that's your MAGI income. And if you've got a tax loss, that takes away from it. So you can make $1 million, but if you got a $2 million tax loss, you're going to wind up on Medi-Cal. So here's the income chart. And so I have some people tell me, no, they don't qualify for subsidies, but no, you can qualify at subsidies theoretically up to 600% of federal poverty level, or $76,000 for a single. But I'm not telling you 76,000. I don't want you to memorize that, because next year it's going to change. And don't say, well, you said 76,000. No, it's not what I say. It's what this chart says. And everything changes all the time, more often than I change my underwear. So on the converse side, if you make less than 17,601, you're going into Medi-Cal. And don't tell me next year that I said 17,609. The chart's going to change. That's why I'm showing the chart, and that's why I don't like the telephone, because then you don't see the chart, and some people want to quote what I say and then argue with me. It's not what I say. It's what I'm showing you where the chart is, and that's what it is. And if it's complicated, I'm sorry. So aside from making everything more complicated, they cut our commissions tremendously. So I do love doing Zoom meetings, because at least then you can see what I'm doing. So when you make an appointment to do a Zoom meeting, if you've never used Zoom before, please go to zoom.us/test, and then you can test and make sure everything's okay. And I have enough trouble with insurance and doing my website. I can't really troubleshoot if you're not able to connect to Zoom. Now, 9 out of 10 people that I deal with have no problem, and some we just have to do a workaround one way or another. And I'll get to my scheduling page in a second. So here's the scheduling page, steveshorr.com/intro/set a meeting, but the link will be there. And it's also at the bottom of every email. But you just pick. So I know I'll have some people want to call me on the 11th and have them interpret the Texas versus USA. Well, we'll see what I could do. But whatever I do, I'm going to give you a citation for it, because I'm not an attorney, and I already showed you I'm not allowed to interpret law for you. Now, I can interpret insurance, but not law. And I can tell you where to find what MAGI income is, but I can't tell you how much your MAGI income is. And if it changes, you got to report it. So anyways, you just go through this and set an appointment time. And I really would appreciate if you let me know what your questions are so you can look them up, because I give the correct answers with the citation. If you don't care if your answer is correct, then just call Covered California, or call a navigator who's got, 3 months of training. I've got more degrees after my name than in my name. I don't like to brag. I think I'm humble. But I do have a degree from San Diego State in insurance, and I also have an advanced degree in insurance, chartered property and casualty underwriter. So, I was asked about capital gains on the sale of your home and what year does that count and yada, yada. So, I didn't even read the materials here. I just looked and I made a reference page for you. So I have everything in one spot. Whereas if you go to, the IRS site, yeah, they'll tell you something, but I've put their materials all on one page. Here's about selling your home. Here's moving expenses, home energy tax credit. I've got it here, I think, better organized than the IRS does, but they're the ones making the law and interpreting it, not me. So ask your CPA. Well, for next time, I really should have gone through here and what do you call it? Cut out the pages that were duplicates. Anyways, this is where I'm monitoring the court case coming up on the 10th about whether Obamacare, in the lower court, it was ruled unconstitutional, and you never even heard about that. The Supreme Court is going to start hearing argument on the 10th, and, from what I've read so far, the soonest anything will probably happen will be maybe in the summer. If you look in the comments, because I didn't have time to redo the whole page, probably the best place to look at is the link for Kaiser Foundation on the guide to challenging the act. So now to get to a little more detail on saying like what's better, the Sutter or the Blue Cross and Blue Shield are two totally separate companies. So, and Blue Cross is an EPO, not a PPO. And one person that just asked said they want the Blue Cross PPO. Well, there is no Blue Cross PPO. And I don't think a phone call's going to resolve it. You got to look at and see if we're both looking at the same thing. So, just as example, $55,000 MAGI income for 2021 will get you a $480 a month subsidy. So if you take the gold PPO with Blue Shield, with that subsidy, it's going to cost you $1,158. And see, the real premium is $1,638. So you say, what's the premium? The real answer is $1,600. Yeah, your net is $1,158, but no, the premium is really $1,600. So I had someone else recently say, oh no, my premium's, $1,100. And then one of the people in the family got a job. And once you have a job that has insurance, you're no longer eligible for subsidies. So this quote is meaningless if you're not eligible for the subsidy for one reason or another. So you can look and say, oh, I'm going to take this. It's this or that. But no, it's meaningless. It's worthless. And I don't want to be involved in litigation. And that's why I give you a citation. And what do you call it? So there it is, the PPO. Now, another wonderful thing that this quote engine does is you can compare these side by side and then click compare. And you can compare as many plans as you want at one time. So, here it is. The Blue Cross is $800, Blue Shield is $1,100, and Health Net is $1,800. Why is it so much? Well, I would say look at the doctor list because maybe their EPO is bigger than Blue Shield's PPO. If you go to the pages on my website where I have a provider for each company, then, two things. On some of them, I do have that I copied from somewhere, like how many doctors are in the network. But the thing is really just to go to the provider list and find it. So here you've got at the bottom it says provider directory, so you can go there and make sure your doctors are in there. So going back, well, I'm going to pause this so that you don't see the person's name, but we'll go back separately and I'll show you what the Sutter rate would be for this person. Okay, so the Sutter rate for their gold, and it's a HMO, is $1,400. So you could turn around and take an HMO with other companies, but maybe the person that, asked, wants to go to a wider range of doctors, maybe wants to go out of the Sutter network. So it's just a question of, looking at these things and what you think, how good the doctors are. I can't really tell you how good the doctors are because I haven't been to that doctor. Now, there are websites, and I link to a lot of them, that will rate doctors, but it all basically comes down to what's one person's opinion and how vocal were they. I myself, when I go to the doctor and I get a survey, I only fill it out maybe 1 out of 10 times. It's like I got other things to do. If they want me to fill out a survey, then pay me for my time. Which, on another thing, I'm like, don't tell me that you're going to enter me in a raffle. You want to pay me to do a survey, then pay me. Otherwise, leave me alone.